So I called everybody on the panel last week and talked to them before this, and I asked everybody, what is the biggest success of the ACA for patients? And each one of you said the exact same thing. And that was guaranteed issue, the fact that anybody is going to be able to get health coverage or health policy because they can't be denied for pre-existing conditions. So I'm going to put you guys on the spot a little bit, and I'd like you to talk about that if you want to, and how big a deal that is for people with chronic conditions, but also what else has been a big success for consumers in this past year. And I'm going to start on the end there with Dan.
Thanks, and thank you all for having me here today. I mean, exactly as all of my colleagues here have said, guaranteed issue, being able to get health insurance no matter what, even if you have a pre-existing condition like cancer, has been a huge deal. I think in our facts and figures report, it was estimated 172,000 people in California would be diagnosed with cancer in 2014. So huge deal. Medicaid expansion as well. I mean, this is a population that up until this point has not been able to have access to, afford, of course, any kind of health insurance in the private sector, but in addition to that, have also not been able to get any sort of preventive services, chronic disease management. So being able to get those individuals covered through Medicaid expansion for states that choose to do so is also a huge win. And I think another thing that you and I discussed earlier, which I always try to say is also a win, and not to shift to negative, but a lot of the issues that we're going to talk about that are challenges have existed far before the ACA was ever passed and implemented. So things like having difficulty finding out what doctors are covered, having difficulty finding out if your drugs are covered, just understanding health insurance in general. That's always been a challenge, and the ACA has really kind of pushed us to start having those conversations again about how to fix those problems, and I actually see that as a huge positive to the ACA passing as well.
That's an interesting idea, that transparency was a problem. It's
Sure.
still a problem,
Sure.
but it's hopefully going to get
We're
better.
talking about it.
Yeah. And I hope you guys, since we're seated this way, that it will be a discussion, so you guys can kind of jump in, and I'll direct you at some points. But who wants to go next? We'll go in forward.
Because I'll pick up on that last point that you made about education, because you have the Affordable Care Act, and the options that are available are just so much better than it was before. But it's only better if you know what to do. And it's only better if you know where to go. And some of the things Dr. Thorpe talked about with the system, someone has to help you get through that. Someone has to be able to educate you, and for you to understand what your self-responsibility is, how you can self-manage, and then how you can get involved with shared decision-making. If that's shared decision-making with your family, or shared decision-making with your healthcare provider, or shared decision-making with the advocacy organization that you work with. But it's very important, because no matter how good the system is, if people aren't able to access it and understand it, it won't take us to the next step. And we can't forget that this is a new purchase for just about everybody in the United States. No one knew anything about healthcare, except that they had a card, and you walked into your doctor and you gave it, and you hoped that it didn't cost you too much when you walked out. And this is a whole different area. But one of the things, if it's okay, Emily, I wanted to give an example of the good that has happened with the Affordable Care Act when it was introduced. And this is, I'm going to read an excerpt from a blog of somebody who has diabetes, has had diabetes since they were 9 years old. They're now around 29, 30 years old. And this was during the first year when she went onto the website. And she lives out here in California. And she had been someone lucky enough. She always had insurance. She didn't have any problems. She was someone that was well off, and her family was well off. So it was coming from, it wasn't that this is a new thing for her to have health insurance. It was just the availability of the Affordable Care Act. And it says, now remember, I'm her, not him. So on October 1st, I went to my state's ACA exchange, covered California. But non-committal as I was floored by what I saw. I filled out the simple questionnaire on the website to see my options. They asked me about my age, my income, my family size, and that was it. No medical history. No, do you have diabetes? No, are you more likely than average to get kidney disease and retinal disease and neuropathy? No, do you cost a fortune because of all the medications you need? No, have you already had cataract surgery because of this stupid disease? Age, income, family size, and then I was presented with options. The same options my healthy young male husband sees. The same options every late 20-something sees. It's an amazing feeling. After almost 2 decades of feeling tied to a single option, an option I like and I'm extremely grateful for, but still a single option, I felt liberated. Even now, I get chills just thinking about that feeling of, hey, you're just one of us now. It's incredible. It's profoundly American to feel like I have choices and the freedom to move. Death and taxes may be all that we're guaranteed, and you can argue back and forth about whether healthcare is a national right, but you'll have to excuse me while I sit here and enjoy this intoxicating sense of liberty I've just been given. And I think we need to not forget that when we get into the issues.
Well, that's actually very touching. I bet she saved a lot of money, too.
Yes.
So,
Liz, is there anything specific to California that you wanted to mention?
Sure, and that's very heartfelt and really, sums up what people have had to go through when they couldn't get insurance, and the fights that we had for any little pre-existing condition where you would be excluded from being able to purchase some type of health insurance, health coverage. So we're very happy about that. And we have lots of good things to say about Covered California. We've worked very hard with them. We continue to work with them. They're very open to listening to our explanations and our comments and our concerns. And we have one of our members that has not missed, I don't think, a single meeting since they've had them. He's a fly on the wall. That's Jerry Jeffy sitting over in the back. He's our public policy director, and he can tell you, he would actually remember every conversation that they had in every single meeting since they started. So that's really good that there's a lot of openness. The literacy is a huge issue, and so unfortunately, as much as I am, and we want them to succeed. We want people to be able to access the care that they need, and get a culture of health rather than a culture of health care. We can do that as we move over into prevention. So there's a lot of work that still needs to be done. My list actually, though, on the other side is probably longer than the good.
I figured that's why we're starting with the good. But Carl, do you want to jump into this?
Sure, I think a lot has been said already, but our country, we have 40 million people, lacking health insurance. That's a lot of people. So the opportunity for individuals to gain health insurance and health coverage is great, and not to have that pre-existing condition as a barrier as well. And Medicaid expansion is really key as well. Again, before you really had to be very poor and have a health condition, but now that's been taken out. You just have to be poor. It depends. It used to depend on the state, and now it's around the whole country if each state accepts it, and that's one of the problems. Not every state is accepting it. So the opportunity for coverage, and for people living with HIV, less than 20% actually had private health insurance in the past. So this is huge, both the Medicaid expansion and the opportunity for the private market. And just to, I think coverage is key for when you're sick, but as Dr. Thorpe mentioned, and you as well just now, the preventive services is something that we really have to focus on as well. It's not as, it's not as discussed as much as the other, elements of the Affordable Care Act, but the opportunity for free screenings and tests, other tests, is in counseling is really something that we need to focus on as well.